thinking on moving to Spain, or maybe you are already here and you are wondering how to gain access to the Spain's public healthcare in 2025. Whether you are from the European Union, United States, United Kingdom, or any other part of the world, this video today will break it down to you into every single detail. Welcome to Spain Unlocked. My name is Anna, and today we're here for you to let you know all the useful information about Spanish public healthcare. Let's dive into it. Spain has a universal public healthcare system, which is actually ranked in between some of the best ones in the entire world. Funded through the Social Security and Taxes Spanish National Public Healthcare System, actually accepts emergency visits, surgeries, and much, much more at little or no cost, if you don't count the taxes and Social Security, to Spanish residents and Spanish citizens. But what if you're not? What are different ways to gain access to Spanish national healthcare system? First option, if you are a Spanish citizen or a legal resident here in Spain, you are working and legally working and you are paying your taxes in Spain. So boom, automatically you are entitled to a public healthcare system here in Spain. Why? Because both if you are working for someone, if you're Spanish and you were born here, usually either your parents have contributed for you too in the past, or you have worked at some point and you've contributed with your taxes and social security payments to the national healthcare system. Thus, you have a full access to national public healthcare. Also, those people who were working, for example, for a company but now are temporarily unemployed still will have the access to the public health care. It doesn't happen that I'm unemployed, I'm going to the hospital in case something happened, or to an emergency department and they say I'm not covered. This doesn't happen in the public health care. In a private one, if you don't pay for a receipt, that might happen, but not in public for sure. So Spanish citizens and legal residents in Spain who are working, who are pensioners here, retired already people, and those who are contributing with taxes and social security, obviously are entitled automatically to the national and public health care. But what about if you're not? Option number 2. What if you are a European Union citizen and you are visiting Spain either short term or long term, which means that you came here, you relocated permanently to Spain. Short term is also quite easy. The European Union countries, whenever you travel abroad, you could go to a social health system back in your country and they can give you a European Union health insurance card. It's called European Health Insurance Card, EHIC, and this card will provide you health care in case of an emergency. Anything necessary while you are in the other European Union country will be provided to you. So let's say you're here on holidays, something happens, and you need to go to the emergency department for whatever reason. With this card, everything will be covered. Inside of the hospital, public hospital, important to mention, not a private one, they will ask you to fill in a few forms, sign them, they will scan your card, and they will let you pass, and you won't need to pay a single cent for the treatment. The different situation is, though, if a European Union citizen is coming to live permanently to Spain. In this case, what's happening is that either you can get a private health insurance in Spain if you need it immediately to be active, and we have a full video about private health insurances and how does it work in Spain right now. So check it out. It's going to be popping somewhere here on the screen on the top. And if not, you can find it in our playlist. Just put Spain Unlocked private health insurance and you'll see it immediately. However, in general, if you are relocating either as just a resident worker, retiree, or a student, you will, and if it's forever, if it's not a short-term thing, you will need to register at the Spanish Social Security, the INS, Instituto Nacional de Seguridad Social, which is Social Security National Institute, if you translate it directly. So you will need to register there with your name, last name, all your documents, so that you would obtain the social security number, because this number will also appear in your SIP card, which is a Spanish public health care card that you will need to show in any kind of emergency department, in the health center, wherever you go with public health care. You will need to show it to get appointments, etc. Thus, it is very, very important to do. Good news is that all the workers who have been working back in their country, for example, if you are relocating from Germany to Spain, if you've been working in Germany, you could get a specific forms, which are European Union forms, valid for all European Union countries. You get these forms, and basically what they do is that they transfer, in a sense, all your taxes and social security contributions of a kind to Spain. So automatically you will get a right to receive a national health care, because you are in a way contributing with this. You will not receive it anymore in your country, but now you will be receiving it in Spain. And these forms can be taken directly from your social security office and brought here to Spain and registered in our social security office. It takes a little bit of time, but eventually you will achieve it. Apart from that, if you are a retiree and you want to receive your pension in Spain and be covered by healthcare, you can also do so with the same things. There's different types of forms, but also for European Union. For those who are retired already, you just bring up these forms here together with a few more documents to fill in: your passport, your ID document copies. And it's the same thing. You go to the Spanish Social Security, you register them there, and voila, you've obtained your national healthcare system here in Spain, the access to the public healthcare system. If you're a student, more or less it's the same thing. Usually if it's forever, if it's a permanent residency, you will still would need to contribute in some way or get a private insurance. However, students who are coming here just to study for a short period of time, usually the European Union insurance card, which is EHIC card, is perfectly valid and will cover everything that you might need during your stay here in Spain. If you are from outside of a European Union, for example, but you are working here in Spain, you have a residence permit, or if you're not working for someone else, but you're working for yourself, as if self-employed, autónomo in Spain, so-called, then in both of these cases, you are contributing to taxes, even though you're not coming from European Union, but for example, from Canada, US, UK, or any other country in the world that is not inside of European Union. But you have your residence permit, you are working, you're contributing, paying your taxes, you will still be covered with the same national public healthcare system as any other worker or a self-employed person here will do. Because for workers, the employer usually pays your social security. It's like partially. All the taxes and social security has been paid from your salary. And if you're self employed, you are the one in charge to pay your own taxes plus your own social security. So you will still gain access to it. And now, the option number three: what if you're not Spanish, you're not a legal resident just yet, or you will be shortly, you're not from the European Union, and you're not working in Spain? And these are some of the cases, for example, such as non lucrative visas or non-lucrative permits of residence in our country. What to do then? Because obviously you're not coming from European Union, you're not working in Spain. What can you do if there's any kind of possibility for it? And the answer is yes. Here, actually, we can talk about several options. First of these, and the easiest one, obviously, would just be to get a private healthcare insurance, at least for the first time, for a first year that you're living here. Why? Because you're able to get the full coverage, and it is actually necessary for your visa. For example, if you're applying for a non-lucrative visa here in Spain, it's been given for 1 year usually, and automatically to start the process within all the documents that you will need to provide and all the requirements. There is one which is either public or private healthcare in Spain. If it's a private one, it needs to be exactly the same as a Spanish public healthcare. So it means that no co-payments, no exemptions, nothing, no limitations whatsoever. It has to be absolute full coverage from the day one you're coming to Spain. So obviously private insurance in these cases is the easiest way, and a lot of the times it's not as expensive as in your home country. If you need help with this, don't forget that you can contact us with the email, WhatsApp, and our official website here down below. And we can also check out the prices for private health insurance here for you. If you do not want to have a private health insurance, then there is another way, but you would need to be living at least 1 year in Spain, which is called in Spanish convenio especial. In these cases, after living 1 year in Spain, you could, and only if you've been a legal resident, which means that you have been registered with empadronamiento in the town hall, which means you have a local Spanish address, and if there's been a year since then, you could join the payment scheme for this specific convenio. Basically, you would be paying a monthly fee. It's like a private health insurance, but sometimes it is cheaper than a private health insurance depending on the age. So for the age before, so under 65 years old, you would be paying around 60 euros monthly. And from 65 onwards, you would be paying 157 euros per month to gain the full access to Spanish public health care, which means that whatever happens, you would be covered as any other person here that is paying their taxes and social security, because you would be also paying social security in a sense to be covered with a public health care here in Spain. Although in these cases, prescriptions for some advanced age, we will talk about it into details on what the public system is actually like after we talk about who is able to get it. But basically, in these types of coverage, whenever you have a payment plan, the prescriptions are not always covered. So you would need to pay slightly more for your medication than if you would have like an actual social health care system through work or, for example, your pension. It is slightly different, but you would get a full access even so to all the treatments, surgeries, hospitalizations, and much, much more. And the option number 3 is a voluntary social security contributions. This is not available for all people. Many people think that, oh, well, I cannot get a private health insurance. Well, I'm just going to be paying social security instead from the day one that I arrive. And it is not possible, actually. Only in some certain cases, like for people who will be self-employed shortly but need to start contributions already to social security, or for those who have been contributing in the past. Now they're not anymore, but wants to start contributing again to be able to have access to the public health care. This is a possibility, but not automatic at all. How to access the system step by step? Well, obviously, if it's the European Union, we've talked about it already. You need to get the specific European Union forms from your home country, from Social Security, and then you need to transfer them to the Spanish Social Security system. Like this, you would gain automatic access. First of all, you would need to register with the INS, which is the National Institute of Social Security here in Spain. Bring all the necessary paperwork, all the documents. They will assign you the social security number. And then obviously with this, plus your empadronamiento, which is the registration of where you are actually living here in Spain. And this is a key point. Without it, you won't be able to get the National Healthcare System card, which is SIP card. Why? Because you will need to go to the health center that is the closest one to your address here in Spain, in your same neighborhood, or at least the closest one. So you cannot go to any place you want. You need to go to the closest one assigned for your neighborhood. And to check it out, they are asking for empadronamiento, for your document to see where your address, your legal address here in Spain actually is, to make sure that this is the health center where you will need to be going. After this, they will assign you a general practitioner doctor inside of this health center, and they will give you the SIP card. It can be either provisional one for 3 months, which means it's like paper plastic, red and silvery. And then if it's a permanent one directly, it's going to be red and silver, but it's going to be a plastic card, like a bank card or ID document. And like this, you will obtain your card. And now let's talk about emergency care. In a public healthcare, emergency care is always available for anyone. It doesn't matter if you're a tourist, if you're a local, if you're a resident, if you're paying social security, if you're not, if you are on a non-lucrative visa, it doesn't matter. emergency care that actually puts your life in danger is available for everyone here in the country. The other thing is already consultations, doctor's appointment, blood withdrawals, tests, medication, anything else, vaccines, etc. All these are not available, but emergency care is available for everyone. That is the good part of it. And now, slightly more about public healthcare and why so many people, even though it's supposed to be one of the best in the world, honestly, but why so many people are really unhappy with it, and why many of us, including us, actually do have private healthcare, even though we're contributing with our taxes and we fully are entitled and have a public healthcare system. And one of the main reasons is, first of all, we have to be lucky that we have a social security here, that we have a national public health care, not like in some other countries, but at least we have it. We have to be grateful. And it does work really well with urgent cases, with cancer treatments, chemotherapy, etc., etc. It does work very well. But if it's not the case, it works really, really slow. That is the main issue of public healthcare here in Spain. And I'm sure you've heard it already. Public healthcare works really slow, both appointments. If you need to draw some blood work, if you need any kind of appointments for CT scan, or MRIs, I don't know, anything, ultrasounds, whatever you need, or go to a specialist, which is not a GP, for example, to traumatologist, endocrinologist, any other specialist, except for pediatrician for children, because that's obviously like a GP, but for kids, you will need the GP first to book you an appointment. Then they will call you for the appointment. Then you will go to the appointment. Then they might ask some things to be done. You need to wait for that appointment, and then you need to do it, and then you need to come back. And results usually take ages. And also, these appointments sometimes might take for up to a year to be completed. That is absolutely insane. Some parts of Spain, smaller areas, it is quite faster, but bigger cities, capitals of the regions, just areas where there's a lot of movement and a lot of people, these places have a longest wait. And in some cases, things that actually require intervention. Also, for different types of surgeries, it is absolutely the longest wait. Some people wait 1 year, 1.5, 2. It's insane. And for that moment, for example, if it's like a knee surgery or a hip surgery, there's been some trauma to it and it needs to be fixed so that the person wouldn't end up walking in a bad position or wouldn't end up having bigger issues with it. The surgery is 1 year. So in a whole year of this, people end up with really, really bad experiences. People end up actually walking wrong. People end up with absolutely destroyed parts of their body because it's not being healing right, because there was no surgery from the moment it was injured. And that is the worst part of it. So obviously we are thankful that we have it, but there's many, many issues with the national healthcare system and the timing and the way of actually needing to go to the GP first, because before we go to the specialist, it is the longest wait. And a lot of the times, if you are worried about something, you need to go to the doctor fast. You want to get all the things checked out. You want the results as fast as possible. And it is absolutely impossible inside of the public healthcare. And this is one of the main reasons why so many people here in our country, including ourselves, do have a private health insurance, sadly. We need to pay extra money apart from the taxes and social security that we pay already on a monthly basis to actually get fast track access, if you wish, to all the doctors that we need, to get all the blood work done fast, get all the checks, all the scans, anything that we need, and have the results as fast as possible, because that is the only way to actually track your health and improve if something goes wrong. Surgeries in private sector actually can take even the same day or the day after, depending how urgent it is. But in public healthcare, might take months, even years. Obviously, if it's an emergency, it will be done the same day or the day after. But if it's not, time can pass and nothing will happen. So a lot of people are desperate, and this is why we're getting private health insurance. Even though I cannot imagine, if ours is one of the best ones in the world, how do the others look like then? Please light up your comments in the comment section. What does other social security look like? For example, in your country where you live in, or if there's any social security at all. We cannot complain, we have ours, but there's many things that could be done better with it. The good news is that if you're entitled to it, you will have a social healthcare here, a public healthcare system that, even though it's slow, still works in our country. What about prescriptions? The good news is that whilst in private healthcare prescriptions, you have to pay the full price of any kind of medication that they will prescribe you. In a public healthcare, that is one of the better things of it. One of the most positive ones is that you do not need to pay the whole amount for the prescription. A lot of the times, it's just a minimal sum of money, like cents. We're talking about less than €1 or €1 something for the medication that they will prescribe you. Sometimes it's not actually accepted, so they will tell you that it's not accepted by the public health care, but then there's going to be a price on the prescription that you will need to pay. There's no colossal giant pricing, crazy pricing as it might be in other countries, like €500, 200, even €100 or 50. No, prices do range from 0 to maybe €10, 10 something, 20 something, if it's something that's not usually, like, not needed for life, like cough, maybe syrups made of natural herbs, etc. All these things may not be included, but the rest of the actual medication will definitely be. And for some specific ages, if it's a chronic medication or if it's not, it's going to be even free. You won't even need to pay a single penny for it, which is one of the best news. So not everything is so bad, let's say it like this, in the public healthcare here in Spain. Although things might be and should be even better than that, especially in case of timing and waits. So there you have it, a more or less full guide of understanding Spanish public healthcare as a foreigner here in Spain, whether resident or not. You have it all in this video. If there's something else that you will need to know, let us know here in the comment section. We'll answer you as soon as we are able to. If you found this video helpful, click a like, subscribe, and comment down below to help us reach more people interested in relocating to the sunny country of Spain. Welcome to Spain, and make sure to stay healthy. Goodbye.